It also gives me great pleasure to invite to stage the person who's basically overseeing this magnificent pavilion at Expo 2020. And may I now ask Mr. Justin McGowan, Commissioner General for the Australian Pavilion Expo 2020 Dubai, to come to the stage and welcome you.
Assalamu alaikum. Welcome everyone, welcome to the Australian Pavilion. It is a real honour to be able to host such a wonderful group. When I think of the events that we've hosted in the Australian Pavilion, it is true to the ethos of Expo, connecting minds, creating the future. But in particular, when we have events like this, where we have the best health professionals and organisations from both the UAE and Australia, it's wonderful to see this level of bilateral collaboration.
Ladies and gentlemen, special guests, I have to start by saying Happy Australia Day. 26th of January is a very special day to those of us from Australia, and although here in Dubai we're going to be celebrating Australia Day on the 29th, back at home everybody's been celebrating today, and I couldn't think of a more appropriate place to be on the 26th of January than in the Australia Pavilion and celebrating with all of you.
It's a great pleasure to welcome you all tonight, distinguished guests and ladies and gentlemen. It really is, to Justin's point, a real pleasure to host you tonight. I'm so pleased you could all make it. And I'd have to give full credit, I know Stephen talked about this, to Justin and the entire Expo team. They have done a fabulous job in presenting Australia here in the UAE.
It is my profound honour and my pleasure to be here for the second time at one of the most beautiful pavilions, the Australian Pavilion. Secondly, happy Australian Day, and we wish you all the best as usual. Third, I have to tell you that I'm so glad that finally we have been finalized a big agreement between Australian government and the United Arab Emirates, the field of health and pharma industry, which was forwarded a couple of days back to the Ministry of Foreign Affairs, that we are looking forward that to be acknowledged and signed between the both governments soon, in which it will enhance the relationship between our beautiful country, the United Arab Emirates, and your country, Australia, at the field of medical practice and health, and also the pharma industry.
Salam alaikum. It's my great pleasure to be here with you this evening in the Australian Pavilion with my colleagues, and also in my happy place, which is with healthcare professionals. So it's a great pleasure to be here with you tonight.
Welcome everybody to Australian Pavilion. I'm very proud as a New South Wales Welshman to be able to create a menu for New South Wales today.
What has changed over the last 2 to 3 years, COVID and non-COVID related?
My field is health planning. That means planning for the health of people, as opposed to, say, healthcare treatment, diagnosis, or other things that my colleagues will probably talk about.
If we step a little bit back, Adam, into the importance of diagnostic in the healthcare value chain, which is something extremely important. I've personally been in healthcare for about 22 years, half of that in diagnostic. Until I got into diagnostic, I only realized the importance of diagnostic in healthcare.
The key requirements are twofold. Firstly, from the regulatory side of things, to make sure that your software is compliant with data, interoperability standards, can it be integrated with EMRs, is the legislation that's coming in the UAE that might impact on that, and there's a lot of positive changes here happening with ICT laws and data residency, etc., which is great. As you said, a can-do attitude. I think the second thing, which is a very obvious thing to say, but any kind of automation should reduce costs.
Second panel session, I think, follows very nicely from the first one, where we're talking about medical devices. A lot of medical manufacturers today are trying to bring connectivity with their products, and also we are not talking about products anymore, we're talking about solutions.
In Cochlear, we understood the importance of connected care, and we have been investing in this for the last couple of years because we realize the importance of how they can give the opportunity to open up access to patients to have hearing healthcare with a remote support.
The big thing will be moving from individual devices to more integrated systems, how they interface with the Internet of Things, and how we increase the connectivity between information systems and providers.
It requires really good partnerships between clinicians and the people developing the technology.